grown in our lungs and can cause symptoms such as cough at least 3 weeks or longer, coughing up the blood, and chest pain or pain with breathing and coughing. And we have another symptoms that can cause disease for tuberculosis, which is fever, fatigue, weight loss, chills, and sweating at night. We have a latent TB and active TB. Latent TB, latent TB is in this condition you have infection, but you don't have symptoms. Unlike active TB, you make sick and you have symptoms. Diagnosis of tuberculosis. Diagnosis of tuberculosis is very important uh, to diagnose in early stage to reduce the transmission of Mycobacterium tuberculosis and the death. Here are some methods that usually used for diagnosing a TB person, but not all stages can be used. The chest X-ray and the chest CT scan belong to the imaging test that they usually use the negative ion to show the white spot. It means you have been infected with the bacteria. If the chest X-ray is not a clear image, then the doctor will advise to do the chest CT scan because chest CT scan is more clear than the chest X-ray. The speckle culture, they they use the mucus sample. This is the quick and very easy because the the result is within 24 hours. The manual tuberculosis or the TST, they will inject a small amount of liquid in your skin. The results will be within the 2 or 3 days. If if you show the red spot, it means you have negative to TB. If green swollen spot, it means active you have been infected with the bacteria. The interferon gamma release assay or the blood test, they will assess the blood test, a blood sample tested on the bacteria to see if your immune system reacts to the bacteria. The urine culture, the bronchoscopy, a scoop inserted inside of your nostril or mouth to see inside the lungs and airways. In the end of the tube, they will flip the light and the camera to see the image, the biopsy, the lumbar puncture, and the fluorescent test. Ini bacteria need to be cultured to determine the exact cause of infection. Often combination of therapies required for better occurrence. In the field resistance, higher order of antibiotics and antibiotics multi-drug resistant TB is harder to treat. To fight the infection or treat the bacteria, the most common TB drug is isoniazid and amoxicillin. Pyrazinamide and salbutamol for the first 2 months of treatment for use. During treatment, you must use antifreeze injection at each using high-calorie protein restricted routine. The pulmonologist who is specialized in diagnosing and treating the condition that affects our respiratory system. TB treatment management drug therapy monitoring is needed from isoniazid overuse. Educating people about TB is very important. The BCG can prevent severe TB for the children. Always use tissue to cover your mouth when you cough, laugh, and sneeze. Seal the tissue in plastic bag, then throw it away. Wash your hand after coughing and sneezing. And if you have active TB, you should stay at home. Ventilate your room, cover your mouth, and wear a mask when you are going outside or when you are around of other people. Take all your medicines as your doctor prescribed. Keep all your doctor appointment and don't visit other people and don't invite them to visit you. intervention include promoting air clearance, instruct the patient about correct positioning to facilitate change, and increase fluid intake to promote systemic activation. Adherence to the treatment regimen. Teach the patient that TB is communicable disease and taking medication is the most effective means of preventing transmission. And the number three, promoting activity and educate the patients. The progressive activity schedule that focuses increasing activity tolerance in muscle strength and nutritional plan that allows for small frequent meals. And number four, preventing spreading of tuberculosis infection. Carefully insert the patient about important hygiene measures including mouth care, covering the mouth and nose when sneezing, and dispose the tissue that used into the rectum. Acid pass bacillus isolation. Initiate AAV isolation immediately, including the use of private room and negative in relation to surrounding areas and maintain of 6 changes per hour. And number six, place the forward chaston nearby or tape line bed to the side of the bed to secure for use of the condition. And number seven, monitor the adverse effects. Be alert adverse effects of medication. Etiology of tuberculosis, Bacillus tuberculosis. Mode of entry, tuberculosis pathology. There's a summary factor of tuberculosis include the HIV positive and environmental include the community cause. Diagnostic procedure, it start the physical examination, try and skin test. And start for the sign and symptoms, coughing, hard, hard coughing, chest pain, coughing, and start for the treatment either tube or drip. Tuberculosis is still a real concern today, despite being preventable and curable. TB is now leading infection disease killer in the world, taking the lives of 1.6 million people each year. In order to prevent, we need conclusive education and awareness is the key to that. Finally, we conclude that tuberculosis infection and disease remain common in population, taking the lives of 1.6 million people each year. In order to prevent, we need conclusive education and awareness is the key to that. A combination technical and managerial component is a more modest goal than elimination. Tuberculosis elimination has been defined arbitrarily as no more than one new case per million population per year, or prevalence of TB infection of below 1% of the general population. If someone affected with TB that can lead to disease when still treated by several methods, curable and preventable versus only time TB may not be curable when the person has drug-resistant TB is potentially threatening, you can get infection again. And when the TB wake up, it's time to stay home. You cannot enjoy wealth if you are not in gold health. Stop TB, I'm healthy, safety start with me.
Thank you very much. Okay, so thank you very much. Okay, first, for your research work, okay, kindly rearrange the pages. Okay, I think there's some issue with the number of pages. Okay, it's not in order. Okay, second, I think your slides are generally okay, but towards the end, especially in the conclusion, there's so many information. Okay, so just remember your slides are just your bullet points. Okay, don't have too many information in one slide. Okay, so my question is, what would be the uh, infectious agent that cause your tuberculosis? Okay, maybe Vanessa can answer that.
Mycobacterium tuberculosis.
Okay, thank you, Vanessa. Mirasol, do you agree?
Yes, mycobacterium.
You agree with her? Okay. What would be the common signs and symptoms of tuberculosis? Can you?
So if you have lung vaccine, you will have any signs and symptoms. But it depends on
If you have active fever, for example.
if you have active fever or like coughing too much.
Okay, Anna Marie, you
Yes, doc.
agree?
Yes, doc.
Anything to add on the signs and symptoms? You mentioned coughing and fever.
And signs and symptoms such as fatigue, weight loss, and no appetite.
Okay, so she mentioned about coughing. Okay, sometimes does it come with sputum?
Yes, coughing up with blood or sputum.
Thank you very much. Um, Darlie, where are you? Okay, so what would be the one of the best way to prevent the spread of tuberculosis?
By diagnosing in the early stage, give the proper treatment to the person who was affected.
Could you repeat that one more?
To be diagnosed in early stage and give the proper treatment to the person who was affected.
Okay, so you want to diagnose the patient as early as possible
Yes.
so he wouldn't spread the disease. Okay. Myla, anything to add to Darlie? How to prevent tuberculosis?
To prevent tuberculosis, you could the by by suspected like drinking alcohol and injections, drugs. And
Anne, 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 Anna Marie, or you want to add something?
yeah, and usually if by diagnosing all the methods that usually used for diagnosing a person, blood test, skin test, the sputum culture or the lung biopsy, the lumbar puncture, the paracensis test.
So
This is the
you want to
yeah,
detect,
yeah,
so
yes,
then you prevent
yes, prevent.
infection. Okay. So we're quite lucky, as I mentioned. We have our guest judge this afternoon. Dr. Marian, are you around? Do you have any questions?
Actually, I, I don't have any question, but I just want to say reiterate the fact that when you want to make a presentation, it should be in bullet forms. You know, the slides are very much informative, but your presentation is really very good. There's stage presence, and you kept the audience really interested in what you're saying.
Thank you,
But
Doc.
okay,
And
so.
so